morning to everyone, and it's a really great pleasure to present to you today. Now, as introduced, we move on a bit from the earlier life stages of, pregnancy and infant health to the older life stages. And before we go into the details of the presentation, I just want to point out that nutrition has a very, very broad range in how it can help people live better and healthier. And while traditionally there has been a lot of focus on old ages, the role that nutrition has in, especially in malnourished, hospitalized patients, it's clear that nutrition has a much earlier role already in the healthy aging journey. And here, just want to point out also three other areas that I think are very important to realize what can be done with nutrition. And this is because malnutrition is not only what we see in a hospital setting in undernourished patients, but it can be in the form of a hidden malnutrition. So, for example, a lot of people living with overweight or obesity can be deficient in nutrients, including micronutrients. And this is something that we see also emerging as a bigger problem because of the spread of GLP-1 medications that can lead also to additional nutrient inadequacies because of the lower food intake. Another area that is very important for nutrition is as well when women undergo perimenopause. So with the hormonal changes, the physiology changes, metabolism changes, and with this also this can affect nutritional needs and can open up nutritional gaps. And then there's one area that I will focus on my presentation today, and this is the metabolic changes that come during which, in a, let's say, phase of life that is considered as healthy aging, or it's typically also the phase where maybe a doctor still says you're very healthy for your age, but there are a lot of risk factors that start accumulating that ultimately can accumulate into a higher risk for chronic diseases later in life. And this is why it's so important to start thinking of the right nutrition already much earlier. So scientifically, there's a basis to this in that as you know, when we're young, when we're in our 20s, we are very active. We have a very high what's called an daily energy expenditure. So essentially, what we eat, we burn very, very quickly through physical activity, but also through the basic metabolic rate. However, in midlife, this daily energy expenditure slows down. And then in older ages, so starting at 60, there's another drop of energy expenditure that is also based on the loss of lean body mass. Now, what is also coming together in the midlife stages is that with the lower energy expenditure, there's also a loss of lean muscle mass already, which can have an impact on the way we can metabolize nutrients. It can increase insulin resistance, and this together can, in this phase of life, dramatically increase the risk of cardiovascular diseases and other aging-related chronic diseases later in life. So why is this so important? Because if you think of nutrition for what we call like the clinical malnutrition, it's a bit of a different approach, because in clinical malnutrition, patients are often visibly underweight and often come with a phenotype of low satiety, so there's no hunger for food, and this can be further compounded by medical conditions, by cancer, by chemotherapy, or other conditions. Now, if you then think of the right nutrition for earlier life stages, so the problem is not the appetite, it's to provide a nutrition, as we heard in the previous talk, that is very nutrient dense, that provides a lot of diverse food groups, a lot of micronutrients, the right nutrients at a controlled caloric amount. Otherwise, with too much calories through the weight gain, cardiometabolic disease risk can increase. Now, there's a very strong epidemiological basis to this. So on the left, this are results from a large cohort study that was done by a group in the UK that looked into what if people at midlife were to change the diet towards a diet that's optimized in nutrient density, having diverse food groups, and calculated then or simulated the effect on the potential gains in life expectancy. And here, because I mean, this was a study done in the UK, but I think it's representative for many areas because there's such a gap, and I will talk about this in how people eat in reality and what an optimal diet would look like. This was calculated to be up to 10 years. Now, beyond life expectancy, on the right, you see a very, very good study done by the group of Martha Gouache-Ferré from Copenhagen. So her team looked into the effect of different diet patterns on not life expectancy in this case, but on basically what is called health span. So basically, that's a group of categories that ask the question, how long do people live without a chronic disease and how are functionalities maintained? And here you also see that the diet patterns that are characterized by a nutrient density over calories and providing a variety of different food groups, like the Mediterranean diet, the DASH diet, also one that summarized under the Alternative Healthy Eating Index inspired diet. You see that there are very strong effects on maintaining a healthy life over time. However, so this is a study that we did in the Philippines, but it's also, I think, very representative. So what we did in this study, we applied a nutrient profiling system. So it's basically an algorithm that calculates the nutritional value of sample meals, like a breakfast, a lunch, and dinner. And in this case, we calculated this nutrient quality based on meals that are recommended by the Filipino government to represent a healthy diet. And you see here the score of 75 in average, which is considered a quite good balanced score. But we also had data of the reality, how people eat. And here you can see that the average nutrient balance score is much, much lower, below 50, which leaves a very big gap between how people should eat based on dietary guidelines and the reality of what people eat. And so this is like a gap that, I think if we can fill and improve, then this can have a major impact on maintaining health. And so I will go a little bit deeper into these concepts in two different spaces. So one is I will introduce you a new emerging technology that is used more and more for research questions through epidemiological studies, but also intervention studies. The technology is called biological aging clocks. I will talk more about this. And I will also give you an example how specialized nutrition can complement healthy diets for very specific, let's say, outcomes. So what are biological aging clocks? Probably many of you have heard the term already. Essentially, it's a set of technologies that uses large data that calculates, let's say, a health trajectory to have a predictive value of how healthy a person is overall and what it would mean for potential future health. And on the left, you see a graph here done with a biological clock that's called an epigenetic clock. And you see that there's a strong difference in survival probability over 10 to 15 years in people that are considered low or high risk based on whether they're fast or slow biological ages. So it's essentially the question, is someone biologically younger or older than what their chronological or calendar age would say? And a new iteration of these clocks that you see on the right is a concept that's called the biological organ aging clocks. And these are clocks that are also based on a blood test. They don't use typically epigenetics. They use more like proteins measured in the blood. And what they can do, they can predict how fast individual organs are aging. And this is a recent study from Tony Viscori's team from Stanford. And it was quite a striking result because they could show that people with an advanced brain aging, they had a very high risk for Alzheimer's that is roughly as high as the risk of the ApoE4 allele, which is a very, very strong genetic predictor of future Alzheimer's disease. And so what you can do with these clocks now is you can use them in studies to say, can we use them as a measure for overall health status? And then, as I will show you in the next slide, to then use them to do nutritional association studies and identify, let's say, new ways to improve overall health with nutrition. So on the left, you see results that we have from a very large cohort called the UK Biobank, where we categorized people into slow and fast agers based on their biological age. And you see that physiologically, they have quite distinct markers of cardiometabolic health. On the left, you see HbA1c, which is an integrative marker of glucose control that you see is highly elevated in people that are fast agers. And you see also a very dramatic effect on the increase of CRP, C-reactive protein, which is a marker of inflammation. And that you see is in fast agers in a range that is very much associated and causal actually to developing atherosclerotic cardiovascular disease. And so with such data now, we can think of nutritional concepts on how to tackle healthy aging in a more holistic way. So one of the first questions that we asked is, because we saw such a high differences in cardiometabolic health profiles between people that are biologically young and old, we asked the question, what's the impact of overweight and obesity? So you see in the left that with each 5 units of BMI increase, you see an increase of biological age. You also see in the middle graph that people that for various reasons lost weight over a period of about 5 years, they got biologically younger again, versus those that gained weight. And then in an analysis of an intervention study with a very low caloric meal replacement, we saw a reduction of biological age that accompanied the loss of body weight. So overall, we can say that managing a healthy weight is probably one of the key things that people can do to stay biologically young. However, what we wanted to ask as well, if beyond weight loss, what are the other drivers nutritionally that may be related to healthy or unhealthy aging? And here we'll show you one approach that we take using a nutrient profiling system that's called NRF 9.3. And essentially what this nutrient profiling system is, it can ask the question either on a meal or on a diet level, how rich is the diet in certain positive nutrients like protein, fiber, calcium, iron, and how rich is the meal or the diet in saturated fatty acids, added sugar or sodium, which are associated to poor health outcomes. And this gives you a score from 0 to 900. 900 would be a perfect nutrient density. Basically a score under 600, so it's considered to be correlated to elevated cardiovascular risk. And also of note, in the US, about 80% of the population have an NRF score under 560, so clearly in a range where this is associated to higher cardiovascular risk. But also the average is just at 400, so it's not a very high nutrient density in a daily diet in the US, but we also see this in other geographies in the world. In the middle, you see that this nutrient profiling score correlates with the healthy eating index. But again, the one advantage is you can apply it to single meals to analyze data, for example, from 24-hour recall data. And then what you see on the right, what we calculated here is what is the difference in survival probability in people that have a high nutrient density versus a low nutrient density, and in a way that it was adjusted for things like smoking status, education, but also BMI. So to the point previously, we think that nutrient density is a predictor or has an impact on how healthy we age, even independent of the body weight. So here what you see, that's another analysis where we categorize people whether in their aging pace. So are they slow agers or fast agers in 5 different groups? And you can see that the fastest agers on the left, on the right, have the lowest nutrient density, and the slowest agers the highest nutrient density. So what does this mean? So I think, as we heard in the previous talk, I think it's very important to promote a balanced, nutrient-dense diet during healthy aging. So especially the time, before you get into more of a clinical nutrition scenario, where also, adding calories into the diet, supplementing with calories is key. Here, it's about optimizing nutrient density over calories. It's also there's opportunity potential to use solutions that can complement the daily nutrient density beyond micronutrients, so also fibers and high quality protein. And this is, I think, a very important area of research, how this can be done optimally, because we know that changing habits is very difficult. While you can promote slowly over time that people eat better, it's very difficult to change habits completely. And there will, in my opinion, always be a gap that you can optimize the daily nutrient density. And so if this is done in combination with nutrients that can act on certain physiological drivers of aging, like high inflammation or low omega-3 status, potentially via precision nutrition, I think you can really get into a holistic approach via diets and nutrients to maintain good health in a stage prior to severe health conditions. Now, I want to give you just a very quick overview of one approach that I personally find very interesting. And this is the question: are there specialized nutrition approaches to complement a healthy diet to achieve specific outcomes? And so one area that we also heard, which was in the previous talk, very critical to a healthy pregnancy, and this is the way our body can manage the absorption of carbohydrates and then the glycemia in the blood, basically removing glucose from the blood and moving it into the tissues for the diverse metabolic functions. And what you see here is data that was collected from continuous glucose monitoring devices and compared people that are older adults, so overall healthy overall adults over 60 with young people. And you see that there's a big difference in, first of all, the overall glucose levels in the blood, but also the way the bodies respond to a meal. So you see the peaks are basically the postprandial or the post-meal glucose excursions that are quite different. So why is this important? Because elevated fasting glucose and high or impaired postprandial glucose contribute over time to cardiovascular risk. But also what we found very interesting is that there was very compelling data that glucose control, especially in people with diabetes, has an impact on sleep quality. So in other words, if the glucose variability is very high and during the night glucose can go from too high or too low, it can affect the depth of the sleep, the quality of the sleep, and the length of the sleep. And so what we found very interesting about this is that you are in a basically a scientific area where nutritionally we can impact a physiological process, glucose control, but potentially with effects on long-term health, so prevention, but also on short-term well-being, on sleep quality. And I think this is very powerful because your patients, of course, they are always willing to follow the guidance of a doctor or a dietitian, but if the benefits are hard to feel, to see, and they're very much in the future, it's very difficult to adhere to them. So I think whenever we can bring long-term prevention into the more short-term perceived benefit space, I think it's a very powerful way to manage health of people. And so this is a research study that we did and in which we made a nutritional blend that on one hand has an ingredient which is called mulberry leaf extract that reduces the absorption of glucose after meal from the gut into the body, but also a blend that promotes sleep through provision of protein rich in tryptophan, which is a precursor to make melatonin, which is your sleep hormone, plus additional vitamins and minerals like B vitamins and magnesium. And here focus more on the effect of the glucose. So what we saw is that with this blend, after a meal, people had a lower absorption of glucose. But more importantly, what you see on the right, people had during the night less variation in the nocturnal glucose. And they had next day perceived improvement of a fatigue score, of a sleepiness score. So they were basically less sleepy, and they had a better mood. And we could also validate these findings through a methodology called the ActiGraph that also analyzed the sleep quality. So this is an early stage study. It's a research study. This is to point out that this is the research in progress, but it's very interesting finding to show that there may be a link between nutrition, the way our body handles glucose in the evening, and the quality of sleep during the night. And then because sleep and also the glucose control overall have an impact on long-term health, we feel this could be one way also in people suffering from poor sleep to complement a healthy diet. And with this, I summarize. So healthy longevity requires age-adapted nutrition, and especially a focus on nutrient density and management of cardiometabolic risk for younger, healthy subjects. I also spoke about biological aging clocks as emerging technologies, both for epidemiological studies, but also as a health span biomarker in clinical research. And then I gave you one example of a nutritional solution to support evening glucose control to improve sleep quality. And with this, a big thank you, and I'm looking forward to any questions that you may have.